Third quarter training for Benicia emergency response teams focuses on triage and emergency medicine.
Now we're coming to the actual treatment of injuries. If your responders have not, the paramedics have not responded, the EMTs have not responded, you will start to treat burns as well. Very important to treat burns. The skin is very important function of barrier to keep the fluid that's inside the body. And if the burns have resulted in a loss of skin, then you could lose a lot of fluid and you could go into shock, just the same as bleeding. You're not losing blood, but you're losing fluid. The other important function of the skin is it keeps our temperature just right. It prevents our body from losing our core temperature. So when you have extensive burns, these patients become hypothermic. Their temperature starts to go down. You need to keep them covered. If you cut off the clothing, or if you find somebody that's has actively burning clothes that you need to remove the clothing, you need to then cover them back up, because if you leave the burns open, the temperature will go down, they'll get hypothermic and they'll die from hypothermia. The third thing that the skin provides a function is that of infection. It keeps us from getting infected. Once the skin is burned, we are very likely to get infected. So you want to keep it in a clean environment, try to put clean clothing on top of it, or clean pieces of gauze or bandages, so that that person wouldn't die some days later from infection. So these are the various do's and don'ts for burns. As you can see with the elevation, it's the same concept for shock. Try to give them an auto transfusion of blood by elevating the leg and thereby draining all the blood that's normally in the leg back towards the chest and toward the brain. So burns are basically of three kinds. A sunburn is what kind of a burn? Is that a first degree, second degree, or a third degree burn? First degree. A sunburn is an example of a first degree burn. A blister is an example of a second degree burn. If you have a burn where you can see the bone or you can see the muscle, that means it's all the way through the full thickness of the skin. That's a third degree burn. Usually those patients do not complain of pain, and usually those patients die because they have no barrier of skin, so they're not able to maintain their circulation. They lose fluid. They're not able to maintain their temperature. They get hypothermic and they subsequently get infections and they die. So a burn patient who tells you that he's not hurting is very serious and will probably die of his burns. Start your triage and provide rapid transport. Be sure you tag them as a red, as an emergent, identify that they have a life-threatening injury that they are going to die of unless they receive definitive treatment immediately. Make sure that they are breathing. See if they have any pulse. If not, elevate their limbs. Try to restore circulation to them because they're losing fluid from their burn. See if they have any mental status changes along with that, if they're getting into deeper shock. Tag them, document them, and transport them as soon as possible. If you have more time and now you're starting to treat the burn, then do all the things that were listed on the previous slide. Remove the garments that are burned as much as possible. Try to keep them clean. Try to cover them up, and that's the best you can do. This other situation to deal with, if you can get the persons through the triage, if you can restore their breathing and you can restore their circulation, now you have to start considering things like hypothermia. Like with the last triage, we had hypothermia here. The best thing, if you are alone and you have just one victim who is suffering from hypothermia, who is very cold, and you have nothing else available, is supposed to be to take off all your clothes and get into bed with them so you can use your core temperature to warm them up. Obviously, you may not feel like doing that for everybody. You may feel like doing it for somebody, but at any rate, you want to be very careful about this. Yeah, select your victims here. Now, you know, it's a hunky-looking victim. I may not mind checking out. At any rate, you want to basically deal with these patients the same way you would deal with anybody else. If they're unconscious, put them in a recovery position so they can maintain the airway. Try not to offer them alcohol or anything like that. Obviously, it can mask confusion and brain changes and become difficult to assess if they're getting into deeper shock or not. Amputation. So we dealt with this on the mega code, and once again, the important thing is to try in a multi-casualty incident that you will be involved with. There may be multiple amputated parts from multiple victims. We had a very helpful rescuer scoop up all the amputated parts into one big bag and give it to us. And then it was the medical student's job to identify which part belonged to which one. And at the end of it, that medical student was ready to amputate somebody's body parts because he had to go through all of that. So as far as possible, keep the amputated parts with the victim. Try not to put it directly on ice. Don't put it in Clorox or in bleach. Don't put it in formalin. Just, treat it just as if you would treat your normal body that is alive. Just keep it clean, keep it covered. You can keep it cool, but not cold. You don't want to freeze it. Or you could put it in chili and serve it at, was it Popeye? Okay, so treating impaled objects, we actually have a model here of a heart. You can see that the heart is a hollow organ, and it has chambers inside of it that contain blood. And if you have a foreign body that enters through one surface of the heart, it's usually going to be the right ventricle. The right ventricle is the front portion of the heart, and it contains blood under very low pressure. So someone who has a foreign body, maybe a piece of glass or metal in a building collapse that has entered their chest, is probably not going to die of that. It looks horrible to see somebody have a metal body in their chest, but it's probably in the right ventricle where the pressure is very low. As long as you can stabilize that there in the heart, and I'll pass this around, you can see the right ventricle is very large and it comes to the front. Most of the injuries usually take into that. They can survive that injury. If they could get to the hospital and we could open the chest, we can remove that and sew the hole over before it sucks air in and circulates air in the body before they die of that. They usually don't die of bleeding. They usually die of an air embolus. Treating fractures. We talked about this as well. You can use splints of different kinds. You can use cardboard. Remember, if you're trying to splint a long bone, you want to splint the joint above and the joint below. Then you can assess that area of fracture. It may be an open fracture where the skin over it is also torn and they're bleeding around it. You don't want to cover up the fracture site. So if you cover up the joint below and the joint above, then that fracture is now stable. Does everybody get that concept?